Hi everyone, I'm Nurse Adorable, and today I'll be talking briefly about hemorrhage, which is known as bleeding. Bleeding means loss of blood. When you are losing a blood, either it can be from a open wound or it can be from an internal bleeding. So today I'll be talking about what you can do to arrest an external bleeding, to stop an external bleeding, or what you can do to help someone who is around you, who is bleeding, and the person is around you, what you can do to make that person survive and not to lose lots of blood. So stopping bleeding is essential to care and the survival of a patient in emergency situation. So when someone is bleeding can lead to shock. It can lead to just like hypovolemic shock. Too when there is severe loss of blood in the system, this can lead to a reduction in the level of red blood cells in the system. This can lead to hypovolemic shock, and this bleeding, as I've said, can be an external bleeding or an internal bleeding. So how to give a first aid care to a patient with external bleeding, that's what I'll be focusing on in today's video. So what you do first is that you expose the site of that wound. Definitely an external bleeding is going to be coming out from an open wound. So what you're going to do is that you expose the site of that wound. After exposing the site of the wound, you remove any debris whatsoever at the site of the wound, and you apply pressure. You clean the site and you apply pressure. You use a clean, I think what we can easily have around us is a clean cloth, a very clean cloth. We use it to apply pressure on the site of that injury. Applying pressure on the site of that wound will reduce the loss of, it will constrict the blood vessels, and it will not allow further loss of blood. So after applying the pressure on the site of that wound that is bringing out the blood, that is bleeding, so what we're going to do is to elevate the injured part. You elevate the injured part. This will also reduce the bleeding. Do you understand? It will help it will stop the venous and capillary building. Then if the injured part is on an extremity, what you do is that you try to immobilize the extremity, either the hands or the legs. You immobilize it, you prevent movement in such extremity that is being affected, to control further loss of blood. Then and also you have to lie down the person. So it depends on how severe the blood loss is. If the blood loss is so severe and the person need further care at the healthcare facility, you transport the person as soon as possible while you are doing the emergency care. Do you understand? While you are rendering the emergency care to that patient, you transfer the patient to the nearby hospital. So internal bleeding can hide in the anatomical spaces, like anatomical compartments we have in our system, such as the pelvis, our thighs, and our chest, also the retroperitoneum. So how are we going to know if this person is having an internal bleeding? You're going to assess the patient for some signs. Such as tachycardia, such as hypotension, like the falling of the blood pressure of the person. When you check the blood pressure, the person will be having hypotension. And test, apprehension, cool or moist skin. So if all these signs are present, then you start to suspect that that person might be having internal bleeding. Someone with internal bleeding needs a medical care as soon as possible, because the person might need to be on medication, or the person might also need to be taken to the theater for some surgical operations. Do you understand? So such person needs emergency care. But what are the things you're going to do while you are transferring the person to the hospital? You make sure that you monitor the person closely. You monitor the person closely, and you make the person to be on a supine position, meaning that the person will lie on his or her back with the chest and face facing upward. I hope you understand that. So that is the position you're going to make that person to maintain till you get to the hospital, and you make sure that you monitor the person, and from there the healthcare personnel will take over the care and make the person to be okay. The person might need medications, and the person might need surgical operations. So that is what you do. That is what you observe, you assess, and what you do in case of an internal bleeding. Internal bleeding, you will not see the blood coming out. That means there's bleeding internally, and the bleeding is escaping into the anatomical compartment of our body, such as the chest, the thigh, those places that I've mentioned earlier. So thank you. If you're yet to subscribe to my channel, kindly subscribe, give this video a thumb up, and share this video to your lovely ones. See you in my next video. Bye.